I'm Jonathan Kaplan. I'm a plastic surgeon based in San Francisco, and I've also been heavily involved in price transparency efforts for the last decade. I recently wrote a Newsweek article about the new No Surprises Act with U.S. Senator Bill Cassidy, who is actually one of the co-authors of the No Surprises Act. He is a U.S. Senator from Louisiana. He's a Republican. He wrote it with Maggie Hassan, a Democrat from New Hampshire. So we still can get things accomplished if we work together. The No Surprises Act was passed as part of a bigger COVID relief package at the end of December 2020, and then went into effect this past January 1st, 2022. If you're a doctor, any kind of provider, nurse practitioner, and if you're a patient, you need to know about this act. Even though you don't know about it, it still affects you. It affects all of us. So first things first, let's talk about how it affects the consumer. The whole idea is to reduce the chance of you getting a surprise bill after any kind of healthcare treatment. And the way to avoid getting a surprise bill after the fact is to tell you about the cost ahead of time. Let's say you're on your bike, riding your bike, you fall, ambulance comes, picks you up, brings you to the ER. They send you to the radiology department to get an x-ray of your arm. They find that you do indeed have a broken arm. The ER doctor puts a splint on you, sends you home, tells you to follow up with an orthopedic surgeon. So after a few weeks to months, you start to get a few bills from the hospital. And remember, that hospital you went to was in network, so you notice that the ER bill was covered by insurance. You still have to pay your deductible, your co-insurance, and your out-of-pocket maximum, but once you hit your deductible, most of it's covered because it was in network. However, you notice that the radiologist who read your x-ray, that was a much bigger bill because that radiologist was considered out of network. The insurance company may still pay for some of it if it's out of network. If you have out of network benefits, your cost sharing is just going to be higher. If you have no out of network benefits with your insurance plan, then you're on the hook for the entire bill from that radiologist. And the thing that's annoying about it is that you didn't really have a choice of who your radiologist is going to be, the way you might choose your doctor. With the No Surprises Act now, that radiology bill can no longer be out of network. It'll be an in-network bill. Now, there are also non-emergency situations where the No Surprises Act will help you, and this is going to really affect women in particular. So let's say you are a woman, you go to an in-network hospital to deliver your baby. You have an in-network OBGYN that delivers the baby, but the anesthesiologist was out of network, the one who put in your epidural. Before the No Surprises Act, you would have gotten potentially a bigger out-of-network bill from that anesthesiologist. Again, if you had out-of-network benefits, then your cost sharing would be higher, but at least the insurance company would cover some of that. If you didn't have out-of-network benefits, you would have been on the hook for the entire amount from the anesthesiologist. Now with the No Surprises Act, that anesthesiologist can no longer charge you the full out-of-pocket cost because they can no longer charge you the out-of-network rate. Does that mean that you can never get an out-of-network bill or a balance bill where the doctor sends you a bill asking you, hey, you need to pay more because your insurance only covered this much? Not exactly. There are exceptions to the No Surprises Act. For the example of women who have breast cancer and want breast reconstruction, a lot of times the plastic surgeons who provide really top-notch breast reconstruction using the DIEP flap or the gap flap, using tissue from the abdomen or the butt to reconstruct a breast in as most natural tissue as possible rather than an implant, those plastic surgeons are oftentimes out of network. So in that non-emergency situation, if you want that plastic surgeon to provide you that type of breast reconstruction, you can get that procedure done, but you will be expected to pay the out-of-network cost sharing. So normally there's the consent forms that you agree to have the operation. Now there's an additional consent form that the federal government has put out that says that you are agreeing to pay the out-of-pocket balance billing, higher out-of-network cost of getting this particular procedure. And that gives up your protections from the No Surprises Act to expect a higher bill after the fact that you'll have to pay out of pocket more for that particular procedure if that doctor's out of network in a non-emergency situation. If it's an emergency situation, they can't get you to sign that consent. They also have to tell you how much it's going to cost. They have to really give you a very good estimate of what your fee is going to be to that doctor, how much you're going to owe after you apply your out-of-pocket maximum, how much you're going to owe after you apply your deductible, however much you've spent in that calendar year, what your co-insurance is going to be for that out-of-network cost. And if you don't have out-of-network benefits, then you will be on the hook for the whole thing. So that's why it's important for them to give you that cost ahead of time so you know what you're getting yourself into if you're going to sign that consent. And then if you don't want to end up paying that, then you go to a different doctor that's considered in-network, so more of your insurance will cover it. So in a review of how this affects patients, if you go to the hospital in an emergency situation, you're not going to get a surprise bill. If it's a non-emergency situation, then the doctor who you essentially don't get to choose, like the radiologist or the anesthesiologist, they cannot give you a surprise bill anymore. And then the third situation is if it's a non-emergency situation, the doctor who you do get to choose, they can have you sign a consent form agreeing to the higher out-of-network cost and higher out-of-pocket cost sharing. The doctor has to give the patient their expected charges for that out-of-network cost, if they have out-of-network benefits, and if they don't have out-of-network benefits, what their total cost is going to be for that particular provider. The other situation where the doctor has to give you a very, very explicit, detailed estimate is in the case of a good faith estimate. The good faith estimate is specific for patients who are uninsured and need to know how much they're going to be expected to pay after the fact, for patients who have insurance but are self-pay, and then patients who are self-pay also includes aesthetics. So you don't have to get a good faith estimate for Botox, one-off Botox or one-off filler, but you do have to get a good faith estimate, and the doctor has to provide you with a good faith estimate for a surgical procedure that includes the doctor's fees, the OR and anesthesia fees, maybe some lab tests as well. And also you do have to give a good faith estimate for known expected recurring services that are going on throughout the year, sort of like a subscription or a membership or laser hair removal. If you know you're coming in for 6 treatments over the course of the year, then you do have to give the patient a good faith estimate for that. So if you are a provider, doctor, med spa owner, nurse practitioner, surgery center, anesthesiologist, this applies to all of you. If you are interested in learning more about the No Surprises Act, head on over to nosurprisesact.com. And when you get there, you'll actually be able to download 2 notices that you are required to put up at your front desk, and a link to each of these notices on the homepage of your website. One notice is telling the patient they have a right to a good faith estimate, and the other notice is telling patients that they have protections against surprise billing. So nosurprisesact.com for any provider that wants to get access to those downloadable documents. They are free, and you can stay in compliance with the No Surprises Act, which already went into effect on January 1st. So if you're thinking this is something that's coming down the road, sorry, you're already probably non-compliant, so get to it. Thanks for listening, and don't forget to subscribe, like, or comment below, and let us know if there's any other topics you want us to discuss.